So the first question is the differences in terms of
different. So actually, let me start with the life cycle.
okay.
So when the company decides to develop any drug, they have a number of teams. One is they start with the theoretic chemist,
Might as well just
where just on the paper
uh-huh.
they identify what are the different therapeutic areas that you want to concentrate on, and then they do a structural analysis and designing where certain bond properties can define certain therapeutic values and so forth. And then they look up the database and then they say, okay, this is my big funnel, these are the narrower properties that I want to concentrate on. They want to narrow that funnel. Then based on the Lipinski rule of 5, they identify what are the likely candidates that can happen.
Is the Lipinski rule of 5 basically a measure or mark that helps assess the probability of something becoming a molecule?
Well, Dr. Lipinski actually observed that if all the drug candidates that they were coming across had certain properties. They were small molecules, so there was a limit on the molecular weight below which likely to be candidate. Then there was a other properties also played into picture, and that's how he has defined 5 rules. Lipinski rule of 5. And it's not always been proven true, so there are a lot of number of outliers, but at the same time this is more generic classification that scientists use just to quickly narrow the funnel.
Okay.
So they once they have a certain database of molecules that they want to start looking at, then they actually use these criteria to narrow the funnel. And one of the criteria that we will add is the toxicity aspect of it. So they can actually add to the Lipinski rule of 5 some toxicity thresholds and say, okay, I don't want this kind of toxicity and this kind of toxicity, and if the values are certain higher than that, then I don't even want to consider this. So we will be helping in that process. So going in general from the discovery stage, so this is the responsibility of medicinal chemist. Once they define that, okay, these are the 200 molecules that you want to concentrate on, then their job is to define the method to develop that pure substance. And that's a method development that they do where they don't care about what they're using to make that molecule. The whole purpose is to make it as fast as possible, and this is where the drug companies want to minimize the cost, because a lot of that work goes wasted, because the whole purpose is to identify further to 4 or 5 molecules. And they need that small amount to study the toxicity of the chemical or see the therapeutic value to validate whether that's really happening or not. So the preclinical studies, very early preclinical studies start at that point as well. Then when the molecule is defined, 3 or 4 polymolecules, now they want to do further studies. At that point, now they want to actually say that, okay, I want to have as pure as molecule. So if it is a chiral molecule, they want to do separation of that molecule, and each enantiomer has to be studied further. And this is where they now need a little bit bigger amount. So when we say small amount, we are talking about milligram quantities. Now, a little bit bigger amount means up to 10 grams. And this is where some companies, the medicinal chemistry people still are involved, but a lot of companies, this is the job of process chemist. And now the process chemists are a little bit more aware of not only whether they can develop the product or not, because this is already established, but now they see what is the best process to develop it. They're still not concentrating on what is the most optimized process for manufacturing, but at least they look at the processes alternatives from the point of view of how fast it is, how many steps are involved, and then what is the yield. Once they have done that, this is where the small clinical trials start, and with the 10-gram quantity or maybe a little bit higher, they do a study on maybe limited number of species and limited number of, if it is a human, then very limited number of human species. Then they establish, now they have narrowed down to probably one molecule that they want to really take it to the end. And that is where the process chemist or manufacturing chemist, combination of that, they work together. They also involve the toxicologist at this point to really study the molecule's toxicity and eliminate any problems that could have. Sometimes the toxicity problems are created by the process, so they may have to change the processes. And this is where the INDs come into picture. When they go from the small scale, the preclinical studies, to the gram quantities, they want to file the IND as soon as possible. So the initial IND is filed, but every time you change the process, they file the IND again, and this goes through the FDA process. So it takes a little while and costs money. And then when they go to establish one molecule, now they're going from IND to NDA. And the NDA is the final approval by the FDA, which this establishes the manufacturing process, and this is the NDA is the final recognition by the FDA on not only the drug's therapeutic value, whether it should be a drug or not, but also they cannot change the process of developing that chemical or drug without actual approval of the FDA. So you don't want to go through multiple approval process of NDA. So, but IND is more typically, companies go through up to 10 IND approval cycles. So what we will do is allow them to minimize the IND approvals by letting the scientists choose less toxic material right from the beginning, and also helping them through identifying the optimized process that gives the highest yield without the addition and with the minimum cost when we have our next product, green analyzer, in place. And green analyzer, additionally, what we will provide is the alternative methods from the point of view of not just the number of steps, but the amount of yield, the cost, and the toxicity factor, and also the amount of waste that you are generating and how to minimize that. So it really takes into account all aspects of the process improvement, and automates that process in giving you the suggestion.